Hello, my name is Dr. John Warren. I'm an optometrist in Racine, Wisconsin, and I fit scleral lenses for my patients who have irregular vision and don't see well with regular means. Irregular astigmatism is the most common cause to fit a scleral lens. There are some other reasons to do so, such as severe dry eye or autoimmune disease in the cornea. But typically I'm fitting a scleral lens for patients with irregular astigmatism. When a person has irregular astigmatism, I'm not able to correct their vision well with regular glasses or with typical contact lenses, whether they're soft or a gas-permeable lens. This causes the patient to have glare, halos, double vision, and just overall generally blurry vision that isn't correctable to an acceptable level. The most common cause of irregular astigmatism is a cornea that has irregular shape to it. This can be due to natural causes such as keratoconus, which is a degenerative disease of the eye, or after refractive surgery such as RK, PRK, or LASIK, patients can develop irregular astigmatism, which gives them poor vision no matter what type of glasses or contact lenses they wear. So to correct irregular astigmatism, the idea is to get the irregular cornea out of the equation and neutralize it. So we use a lens that fits above the cornea, which is called a scleral lens. This creates a liquid reservoir under the lens and in front of the cornea, which neutralizes the irregular cornea and results in very good vision for the patient. The first thing that light hits when it gets to the eye is now the scleral lens, which has a normal regular curvature versus the irregularly curved cornea, resulting in good vision. This is a picture of a scleral lens on a patient who's had radial keratotomy. You can see the scars, which are where the cuts were made during the surgery. In this patient, the radial keratotomy resulted in irregular astigmatism, so the patient had poor vision. By fitting the scleral lens over the top of the irregular cornea, it provides good, regular, clear vision for the patient. You can see how large the lens is, the brown color on the eye. Just outside of that, you can see the edge of the lens. These lenses are larger than the cornea. They're almost the size, or typically the size or slightly larger than a regular soft contact lens. And this is a scleral lens on a patient's eye who has keratoconus. The lens is not yellow or green in color. Rather, the lens is clear, but there's some dye that's been placed underneath the lens to allow for an evaluation of the fit for this patient. It also kind of helps make the edges of the lens show up better, which is why I use this picture to show you the lens. So the previous process for fitting scleral lenses was to use a series of lenses to try to find a lens that fit just right on the eye. With I like to liken it to the three bears approach. You didn't want too much space between the back of the lens. You didn't want the back of the lens to touch the front of the cornea. You wanted it to be just right. So it would take sometimes one, sometimes four, sometimes five lenses to find that appropriate fit by taking a look at the shape of the cornea and then trying to determine which lens is going to vault the cornea and rest on the sclera and give appropriate amounts of clearance. It was a very trial and error method. It worked, but it took quite a long time and it wasn't very enjoyable for the patient. Well, now there's a new way to do this, and it's with what's called a corneal scleral topographer. This measures the curvature of the cornea and, more importantly, the curvature of the sclera, the white part of the eye, which the lens rests on. The scleral curvature doesn't necessarily follow the corneal curvature, so using older technology, there's no way to know the shape of the sclera. So no way to know whether the lens needs to be a spherical lens, one that corrects astigmatism called a toric lens, or a more free-form or very, very specialized lens that's got multiple curvatures on the edge of the lens. So now I take measurements with the sMap3D, and that allows me to know what lens to start fitting the patient with without having to use the three bears approach. So what I'll do is we'll take a map like you see on the lower right that shows me the corneal curvature and the scleral curvature. This patient needs to be started in a toric or an astigmatic lens because of the shape of the sclera. Those dark blue areas show a very flat top and bottom to the sclera and a less flat area to the right and left. So we'll use that information to know what type of lens to design. This patient would actually probably be fit with a lens like you see towards the top of the image, which is a totally custom lens called a latitude lens. That lens actually has different curvatures for each different color zone on the topography map that you see. So it's a truly custom lens in that it doesn't have any symmetry to it at all because the eye doesn't have any symmetry. But by using this, I get rid of all the trial and error that we used to do. So it's definitely a better process. It's better for the patient, it's better for me, it's more efficient, and it's more accurate. By starting with accurate shape data, not only for the cornea, but more importantly for the sclera, I can pick the right lens, typically the right lens the very first time without having to go through a series of lenses. And then we just use that shape data to get right where we need to be. Once we do that, we check the power of the lens and place the order, and the lens shows up about 5 days later, and we have the patient's vision corrected. If you want to know if you're a candidate for scleral lenses, there's really only one way to know, and that's to actually examine the patient. I don't need to do a comprehensive eye exam each time to start the process, at least, or find out if you're a candidate. We can take some measurements of your corneal curvature, what we call aberrometry, which shows me how light moves through the eye, and determine if you have irregular vision that could be corrected with a scleral lens. To do this, I offer a no-charge, no obligation consultation. We'll take a couple of measurements and talk with the patient and determine if this is even an option for them. If it is, then we can discuss what we need to do as far as the process, and then actually get into the actual designing of the lenses. If you're an existing patient who's up to date on your eye care, we can just go ahead and start doing this process. If you're a patient who hasn't had a recent comprehensive eye exam, we will start with an eye exam to make sure everything else in the eye is healthy and we aren't just dealing with one issue when there's multiple. But if you'd like to find out more, give us a call at 262-752-2020 or send us an email at the email on the screen, and we will set up an appointment for you for a no-cost, no-obligation consultation, and we'll find out. You really won't know until you know and find out what your options for correcting your vision are. So pick up that phone or send us an email and we'll find out what your options are, and we will get you seeing as well as we possibly can.